true, right? You are not getting fatty liver disease just from alcohol. So I want to ask Dr. Yvonne, where do you get it? When we say lifestyle diet, it's so general to the reader. But what is it? Do you get it from sugar? Do you get it from bad fat? Do you get it from MSG? Do you get it from processed food? Where?
Okay, so as Dr. Soler and Dr. Jana said, it's really the bad fats, right? And then also sugar.
Yeah.
Because
And first, what are bad fats?
yeah. Bad fats are like the saturated fats. Crispy pala.
Okay.
Okay.
Sarap naman nun! Paano yan? Gusto ko nun. Okay. Paborito ko lechon kawali.
Lechon tuwale.
That's bad.
Oh yeah, the
Oh,
fat
wow.
in the lechon tuwale, and then the oil, of course. It's bathing in oil, right? When we cook it, yeah. So those are the bad
Swan,
fats.
oo.
Yeah. Sugar.
Pati asukal. You can get metabolic associated fatty liver disease
Yeah.
from sugar.
Yeah, because sugar pushes you to have diabetes, right? And that's also part of the metabolic constellation that they both mentioned earlier. So that's also like a risk.
So, Dr. Solano, maybe you can take that first. Is people in the room might be asking, wait a second, my sugar is high enough as it is, may problema pa ako, pwede ako magka-fatty liver? Ang dami ko namang problema, di ba? Because when they go to the doctor will say, hey, your sugar's borderline, ha? Hindi pa diabetic, but borderline. So, Doc, how is that related? People are thinking, why is it my sugar's high? How is that related to my fatty liver? Eh, fatty na ang term.
Yeah. Good question, Karen. In fact, when you study biochemistry in medical school, we know that part of the carbohydrate that's digested in the liver basically turns into cholesterol. So there's a link between carbohydrates and fat. And that is why when you just become obese or you become a diabetic or with just a condition of high blood sugar, eventually that can turn into some lively droplets that invade your liver cells.
Is that the two, just let me ask the doctors before I go to Nikunj, is that the Filipino problem? I mean, based on the patients you've seen, when it comes to metabolic associated fatty liver disease, the patients, is it the high sugar or is it because they're obese? Filipinos.
Yeah. First of all, the answer is the diet of the Filipino is basically high in carbohydrates and high in salt. You can ask all these people here, that's what your basic food that you have grown up with. And both are bad. High in sugar, fatty liver, high in salt, cancer. The other one, of course, is because of the way that we live our lives today, the tendency for less exercise and more eating drives people to be obese. And the basic substrate of fatty liver basically is obesity. And there's a rising obesity in this country. For the last 30 years, the statistics are really on the rise.
Yeah. Well, in terms of the profile of Filipinos, Dr. Solano actually mentioned about the food, but I'd like to focus also on not just food as part of our lifestyle, but also our physical activities. So, physical activity is actually very essential, very important to the treatment of fatty liver. Anyway, I know we're going to go to treatment later, but I'd just like to come forward with how Filipinos and their lifestyle in terms of physical activity is very lacking. Compared to, for example, other Asian countries, Japan or Korea or Hong Kong or Taiwan, when we go there, we do a lot of walking. You get to complete your 10,000 steps a day. But here in the Philippines, we have very little physical activity, and all that physical activity counts. And for example, labas tayo ng hotel, you ride a car, going to the next block. So those things, those little factors that we do not have or lack in our society actually also contribute to this particular problem, because physical activity is very important to the treatment of fatty liver and prevention of the fatty liver So that's one facet of the lifestyle that we Filipinos have. No? Intrinsically, we do not have a lot of physical activity in our daily activities or our daily movements.
Karen, before we leave the topic, I'd like also to emphasize that there's a rise in childhood obesity, not only in the world, but also in the third world, including us. And that is also driving fat liver even in the young. And that is one aspect of fatty liver that we don't often talk about, because we always speak that fatty liver might be just a disease of the adult population. There's very, very scary data about obesity in the young that may have to be spoken about in other venues, but maybe just to emphasize
Yeah.
it.